Yeah, we're ready to start.
Yeah, good morning from Montana. It is 7 a.m. here. And thank you for joining us from all over the world today. We have participants from all the continents and time zones. So thank you so much for joining us. My name is Cristina Tirado, and I am the director of the Sea Foundation. It's a foundation that is promoting sustainability, health, and education. I am a professor on climate change, food, and health at LMU and at Tzu University, and a lead author of the IPCC Next Assessment Report. I would like to welcome all of you on behalf of the co-organizers, the Buddhist Tzu Foundation, Sustainability, Health, and Education, the Sea Foundation, Loyola Marymount University, the Climate Technology Center and Network, UNEP, Proveg International, and the Taiwan Society of Vegetarian Nutrition. So it's a pleasure to be with you today. And just a couple of remarks. For those of you joining through Zoom, please keep off your cameras and microphones and use the chat only for questions to the speakers. And for all of you that are in YouTube Live, you could use the Google link to ask questions to the speakers. So I am very pleased to introduce a very interesting panel today. We have Dr. Asa Mohamed, who is the Secretary General of the Kenyan Red Cross Society. We have Dr. Min Lan Lin, who is the Vice Superintendent of the Tzu Hospital in Dalian and a member of the Buddhist Tzu Medical Foundation. We have Nate Book, who is the CEO of the World Central Kitchen, and Federico Villatico Campbell, who is the strategic advisor of the Climate Technology Center and Network. So thank you so much for joining us today. This webinar is the third episode of a series of webinars on climate resilient development and transformative food systems during the COVID era. So this series of webinars have been aiming to offer a solutions space where a combination of experts, visionaries, and other groups of innovators have been including civil society, scientists, or groups from the UN and other national institutions. They could share, and they have been sharing resilience lessons that have been learned from the COVID-19 crisis. So this has been always framed in a world that was already challenged by the impacts of climate change, of malnutrition, and the increasing inequity that is created by these conditions and COVID-19. So through these webinars, we have been meeting innovators and visionaries that are helping to identify climate resilient development pathways for a transformative both human and socioeconomic systems. In particular, this webinar on climate change and food, health, and social systems resilience, on lessons learned from the COVID-19 crisis, we would like to showcase exemplary initiatives that are addressing current compounding risks and to identify short and long-term strategies to build health, food, and social systems resilience during COVID-19 and beyond. So let's move to the heart of our discussion, and let's ask to our panel to share their vision on how they will, how they have been learning or how they have been addressing all these issues. So we have Dr. Asa Mohamed, who is the Secretary General of the Kenyan Red Cross Society, who always have been in the forefront of all the responses at the national and also at the regional level in Southeast Africa. So Dr. Asa, it's great to have you here. And we would like to ask you if you could frame the COVID-19 crisis in the context of the East African reality of multiple component risks, and to share with us the lessons that your organization have learned to keep not only the health systems, but also perhaps the food systems and the social systems resilience during this crisis in Kenya. Yeah, the floor is yours. Thanks a lot.
Thank you very much, Christina. Thank you to my fellow panelists and to the participants. It's a pleasure and an honor to present at this panel on a very important subject. I think it's something that maybe we cannot do justice to in a very short time, but I will just briefly maybe just talk from our perspective, and in particular, maybe the Kenyan situation and what, as the Kenya Red Cross, we have been engaging in, and maybe some of our thoughts in terms of going forward. Food security is, of course, a very important issue, but maybe to just start on a grim note by saying that the situation of food insecurity is worsening in our country, and this is, of course, reflective of many of the other communities in the region due to very many factors. I think COVID has only just come to exacerbate an already worsening situation. Our country has, of course, had a lot of other disasters happening in the last few months, I would say, because unfortunately, we've been suffering a cyclical scenario where, coming from drought to floods, as well as even including community clashes where communities are driven away from their locations where they could be practicing different kinds of initiatives to actually produce food, whether it is the pastoralists or whether it is the farmers. So I think being driven, of course, by some of also pre-existing vulnerabilities, all these different shocks, including the desert locust invasion that has also come into play in the last year or so in the region, and in particular in Kenya, has affected the food security situation in the country. I think for us, we can also say that in Kenya, we see that the problem is actually great, especially in the informal settlements. And in Kenya in particular, we have quite a number of people that are living in informal settlements, especially in the urban areas like in Nairobi, who are people who depend on a daily wage, which means that they can only be able to put food on the table on a daily basis. And therefore, with the effect of COVID-19, it means that many of them are not able to do so, either because they have lost their jobs or because of other external factors that I will also talk about. So currently, we are talking about 3.5 million people in Kenya that we can say are food insecure, with at least 1.3 million that are in urgent need of food. So this is quite a big population. But we also know that with the impact of COVID-19, it means that these numbers are actually not going to be static, that every other day we have more and more people falling into the bracket of people that will actually require food. So it puts us in a bit of a challenging situation in terms of some of the recommendations that can be put forward, because then we have to be a little bit more agile and also a little bit more I think ready to be able to continuously look for different ways of bringing on board many of the communities. I think with the containment measures as well that have been in place by government to contain the spread of the virus, this has resulted in other issues that have also compounded the situation. For example, the changes in mobility. We had some you can call it, containment of partial, some of the counties in the country. For example, Nairobi and Mombasa, which are the high risk counties for some time, but these have since been lifted. But we still see the effects of some of that change in mobility impacting, of course, the food situation. But also the curtailment of physical socialization, because as an African country and with our community systems and cultures, food is also something that is shared amongst the communities. And so with this curtailment of physical socializing, this also compounds the situation. For example, a lot of us then who live in urban centers get a lot of our food produce from the rural areas where the rest of the family lives. And this was a means of provision of food for many families in the urban centers. But with this containment measures, it means that that may not necessarily be the case, because people could not move to the rural areas to go and actually collect some of the produce. So I think it's important then to realize that also as a country, our counties are also very interdependent, which means that many of the counties are known for producing different kinds of food, and these are then transported across the country. When you look at the question of the household income, like I mentioned, especially in the informal settlement, many of the people now have reduced income, or for those that are still able to even get a little bit of cash, it means then that they have to pay more for less because of the increase in food prices, because those who are selling food, of course, have to take into account a lot of the other costs that come with it. We also see that even the food sharing culture, like I mentioned earlier, amongst families and friends has also been curtailed because of this containment measures. And in particular, maybe just to mention, for example, even street families that would normally benefit actually from the food handouts from a lot of people are also now left in some difficult situations. So for us as an organization, we see, of course, when we talk about the supply chain, this is critical, that not many of the food commodities are reaching markets due to these movement restrictions. But we also see that many of the major markets have closed, and even some of the retail shops where a lot of people, especially in the informal settlements, are able to go and purchase on a daily basis. Production, of course, is reduced either because of mobility of the labor, but also reduced access to inputs. I'll just give a very simple example to say that even for those who have farms, we have had stories from some of them where they are afraid to even allow people to come onto their farm to farm, because of the fear that they could actually contract COVID-19. So that means that many more people who would actually be on the farms to produce food are not able to do that. We also see a number of value addition farms that have had to close down, so which means that this also reduces markets for the farm produce. With increased unemployment, like I said, there's reduced income, but also reduced purchasing power because of the food increases. As I mentioned, Christina and colleagues, I think for us, the locust invasion has only just come to worsen the situation. There are a lot of efforts to try and contain this in the country, but we still have some counties that continue to experience this. And we feel that the effects of this, plus the floods that we had earlier on in the year, which were very devastating for many communities, are really going to worsen this the food security situation in the country in the next coming few months. So in terms of solutions, then I think it's important then to look at how to support the immediate needs, but also looking at the longer term, which is probably the more challenging part, not knowing exactly how the situation of COVID-19 will pan out, but also looking at some of the other factors that could affect the resilience of many communities. So for us as a national society, at the moment, what we are doing is we are looking at targeting different vulnerable groups. For example, I said the informal settlements in urban areas and also rural areas by giving food, in-kind food. So doing a lot of food distributions. At the moment, already reaching more than 500,000 people in the informal settlements. But more importantly, also looking at the issue of cash and voucher assistance, which we believe is very important in as long as the markets are still open and available, because one, we are able to give people choice, that people can be able to choose what they need to buy, but also give them some dignity in terms of not having to queue and to walk long distances to actually fetch the food rations. Using the money platform, the M-Pesa platform, then this has become a very important intervention where we are also able to cut down on a lot of costs that would go into the logistics of actually giving actual food. So more than 400,000 people in the informal settlements in Nairobi and Mombasa have been assisted with the support of our partners, including the EU, the French government through the French embassy here, the International Federation of the Red Cross, and also the British Red Cross. So it's important, I think, to look at in the longer term, how do we prepare to strengthen food systems? And one big issue is actually even the question of storage, because yes, there's a lot of food that is being produced in other parts of the country, but how to ensure that this can be distributed to the rest of the country, but more importantly is also possible to store so that it can also be easily accessible. The use of digital technologies in terms of limiting staff and farmers' exposure, I think this is critical as we continue even in this COVID situation. How do we support farmers to ensure that they can minimize the risk of transmission, but are still able to continue with the work of producing food? I think maybe the question of home food production is something that we need to also bring back on the table. I think especially in the urban centers where sometimes we may have some bit of land, or even using other innovative methods. How can we at least produce some of the basic food right behind our homes in terms of kitchen gardens to ensure that we have at least the minimum food available for different families. So I think the other question was really on the health impact, and it's important to also say that for sure nutrition has been greatly compromised in this situation. We see many households in trying to cope have had to make choices. So for example, reduce the number of meals that they have to take, or even stretch some of the food components, which means then that they are not able to actually have a well-balanced meal. In Nairobi, for example, we are now talking about 44,000 children that are acutely malnourished, and 80% of these are in the informal settlements. Stunting as well is a big problem, and we therefore see that we will have many children who will be at risk of many other infections, coupled with the fact that even immunization coverage has also gone down. So this is going to be something that we will have to deal with going forward. People living with chronic conditions have been greatly affected. For example, people living with HIV, many are not able to continue taking their antiretroviral treatment because of lack of food. Those with non-communicable diseases, pregnant women, and lactating mothers, and of course, people living with disability, who even when we are giving in-kind food, they are not able to reach many of the centers where the food is being distributed, and therefore it has actually necessitated us to be able to try and reach out to them as a community wherever they are found. What we are trying to do as well to mitigate some of this is to, together with the Ministry of Health, is enhance community health volunteer training in all the counties in the country to ensure that there are enough people within communities that can continuously support the households, first of all, in terms of good nutrition practices, but also in terms of monitoring and ensuring that the families are taken care of, but those that need to be referred, especially the children that could be affected, are also referred. But more importantly, also teaching mothers to be able to actually do this monitoring themselves. Because sometimes we know also in this situation, it's not also always guaranteed that the community health volunteer will be able to access some of the homes. And therefore, mothers themselves are being taught on how to monitor and ensure that they can be able to refer their children to the nearest health facility in case they actually need to do so. So I think I'll just stop there, Christina, as an intro, but happy to continue with the discussion and maybe also with questions as we go along. Thank you.
Hi, thank you so much, Asa, for this comprehensive overview. We can hear that vulnerabilities of the most disadvantaged people, the sick, the low-income populations, and children will be more affected by malnutrition and health risks beyond COVID, the impact of COVID-19. We have heard about the fear of going to the farms. We were listening the other day to some video recordings that were coming from a community that we work with in Magadi, in Lenco Bay, and the children, we were asking the children, what do you fear? And they were saying coronavirus. So they were Maasai children, and that was their fear right now. And we have here about the community, the power and successful stories of community work and the need for digital technologies. So thank you so much. And we would like now to invite Dr. Ming Nan Lin, who is the Vice Superintendent of the Dalin Tzu Chi Hospital in Taiwan. And he is also a commissioner in the Buddhist Tzu Chi Foundation, Medical Foundation, and he's president of the Society for Vegetarian Nutrition in Taiwan. Dr. Min has been an important activist in the global climate change arena, promoting vegetarian nutrition. And he has been also a leader in transforming the hospitals in the Tzu Chi hospitals in Taiwan into climate smart hospitals. So Dr. Min, thank you so much for joining us today. We would love to learn more about the experience of Taiwan in the successful experience in preventing COVID-19. So far, the mortality has been minimum, and we would like to know, how this has been done, and how this has been, building up from previous experience, which is true, but also how this will strengthen the health and social systems resilience. So thank you, and Dr. Min, the floor is yours.
Thank you, Christina. It is really my honor to share with you about our experience in the comeback with COVID-19. Then this is the COVID-19 cases in Taiwan. We now have less than 500 cases in only 7 days. Very fortunate because Taiwan is an island, so we take some measures to combat with COVID-19. And then I'll briefly talking about our prevention strategy for COVID-19. I think the most important thing is that we have quite early and then quite successful border control. And there's some quarantine-friendly actions that we'll introduce later. And then the second thing I want to talk to you is about action for improving sense of security, because in this kind of pandemic, citizens tend to be panic, and then they were fear of being infected. So for masks or some stable merchandise, people go over everywhere to the supermarket and buy something because of feel insecure. And then there's some, because of when they're overseas Taiwanese, they come to Taiwan, and because there's this pandemic in the world, so we have to do a quarantine. So how to do a humanistic quarantine to prevent the spreading of the viruses. So there's some action taken. And then the other thing is how to combat the misinformation, because the social media, they're all spreading some misinformations. How to let all the citizens feel safe, and then provide correct information that is important. And I will talk about a little bit about information technology deployed for COVID-19 in Taiwan. And then this is in the airport. We have 3 airports. In the airports, there's some, when overseas Taiwanese come back to Taiwan from some pandemic area, and from in the border that we have we call from Nations Gate to your front door, there airport disease prevention fleet on 24-hour standby. This is called quarantine-friendly transportation taxis. And the taxis, not only in the airport, but also in every county. When the overseas Taiwanese come back to Taiwan, they're quarantined at home. When they have some symptom, and he called special 1922, and then the 24 hours disease prevention fleet will go to their home and then take them to the hospital for tests. And then for when they send a patient to the hospital or back to their home, they will clean all the taxi and waiting for another passenger. And they also, because there's some flights, they're like a whole 300 or 200 passengers. They were sent to the central quarantine stations. So they will also, the government will arrange the quarantine-friendly transportation by bus. And then there's some protection shield along the bus, so people can prevent the spread of the possible spread of the virus. And then for the humanistic quarantine, government compensates for each people being quarantined with $35 per day if he or she should stay at home, well, with a single room and then with a toilet, so they can isolate, quarantine at home, and then the government will compensate with $35 per day. But if they stay in a hotel, they will also compensate with 35, but they need to pay some extra if the hotel is like a 3-star, 4-star hotels. And then there will be daily phone calls to those under quarantine to offer assistance, like if they have some symptoms, or if they want to go to see the doctors, or if they have some psychological stress. So there's some daily phone call. And they also care the cabbage that include 14 surgical masks. I will give you some example of the packages. And then they also provide free online access to exercise video and free online access to movies, so they can stay at their room. So this is we call a quarantine hotel, and now we have like 10,000 rooms for all the overseas Taiwanese come back, or some their relatives or their family members to stay. And these are all the things they prepared. And this is what we call home quarantine kits. And this is prepared by Tzu Chi Foundation. Tzu Chi Foundation prepared more than a couple of hundreds of thousands of packages to all the people come back to Taiwan besides some like dry rice, dry noodle, we also prepare some books for them to read. Like this is Jin Shi, this is Jin Shi, the book for them to stay there, stay at the hotel or in the room to read. And then as you can see, besides all this, there's also some snacks. And then this is the KK box. This is online music and videos. This is all free, prepared by the local government. And then we have some connection with Mozambique on the other day. And also Mozambique, they also provide home quarantine kits for the people come from South Africa. And then the rice is oil, so they can stay at home for like 1 month or even longer. So it can prevent the spreading of the virus. And because not only the physical health, psychological health is also very important, because in such a pandemic, people tend to get, panic. So there's some misinformation. So our Prime Minister Su, he himself will have some this kind of posters to tell all the citizens, don't worry about the food, don't worry about the toilet paper. They are still now, okay, this 800,000 metric tons in storage. It's now for all the Taiwanese for 2 years. So this is a supply of food, daily necessities are all sufficient. And then we have some our manufacturer have Team Taiwan for mask production. Originally in February 20th, there are only 1.88, less than 2 million masks being produced a day. But in 40 days, all the manufacturers work together. And then now in 40 days, it increased to 50 million per day. So the people will feel safe because they have enough masks, only for the medical professionals, but also for the citizens in Taiwan. And then we have a Central Epidemic Command Center, CECC. The Minister of Welfare and Health and Welfare and his colleagues, they hold daily press briefings. So all the correct informations will be online, social media, TV, every day. So it is very popular. So when in the pandemic times, we tend to open our social media or turn on the TV at 2 p.m. So it is, well, they will provide correct information for all the people. And then in the website of CDC, there are COVID-19 information resources. And not only use Mandarin, but also there are different kind of languages like English, and Indonesian language, Filipino, or Vietnam, or Indonesian languages, because there are some workers from all these countries, and they work in Taiwan. So they're all, the government also provide this kind of correct informations. And then not only that, there are some videos, posters, leaflet, and then they will put in online. So we can, and then not only with the Mandarin version, but also some English or even some Vietnamese or Indonesian version of all these small little video clip for all the people to know correctly about all COVID-19 informations. And then for all the small video clip, they were like 1 minute or 2 minutes in TV channels. Every hour, they will put on some, the government, they talk to the TV station owners that they should, they will put like one video every hour to spread the correct informations. to come back with the misinformations. And there also some information technology deployed for COVID-19. You can check online for BMJ opinion. It is on July 21st. There's some contact tracing and quarantine monitoring. The government worked with the cell phone carriers have some we call intelligent electronic fences system. So for overseas Taiwanese, when they came back to Taiwan, they stay at home for quarantine, and then the carrier will check the signals, and then in case, and besides call them every day, 1 or 2 times every day, and check the body temperatures. And they will also, if they leave their home, the intelligent electronic fence system will have alarm, and then they will call them again. And somebody may be think about that is invasion of the privacy, but in this kind of pandemic area, all the citizens say that it's okay because for prevent the spread of the virus. And then Christina talked about we are a climate smart hospital because Tzu Chi Foundation work on environment protection for more than 30 years, and all the hospital we think that we are health promoting hospital, but not only promoting the health of people and patients, but also the environment. So there's a lot of system. I don't have time to share with all what we done in the hospital, but like we have some like intelligent building energy monitoring system, check the air condition, the electricity, and Tzu Chi is a Buddhist foundation, so all the Tzu Chi hospital provide plant-based diet only. And in the year 2018, we provide more than 3.6 million meals. Will cut down the emission of carbon dioxide by around 3,000 tons of carbon dioxide. And this is what we have done. Then you can see the signal with this is like a Chinese character I, L-O-V-E, love, L-O-V embedded here. So we say that if you have so much love and then you have so much strength. Okay, thank you for your listening. Okay, this is my sharing. Hello, Christina.
Yes, thank you so much for your presentation, Dr. Min. We have been hearing about the successful stories, but with the modesty of Tzu Chi, which is a trait. I would like to also to add to your presentation that Tzu Chi has been doing an amazing job with all the donations through the world. So Tzu Chi currently has been supporting more than 70 countries.
Yeah, now we about like more than 60 countries around the world, like Mozambique, like in some African countries, like in South Africa, or some other country, like in Philippines. We distribute all the food, plant-based food, for people who have not enough to eat. So this is from the Tzu Chi Foundation. We have now more than 60 countries. We have Tzu Chi office there, and they're all as NGO. We are a charity foundation, so we do all the help.
Yeah, thank you so much for that. And it's an amazing work that they have been doing since the COVID-19 crisis started. So thank you for sharing your views. We have been hearing about the importance of the Control Epidemic Command Center, which was a great success in stopping from the beginning the epidemic. And not only that, but that all the approach of the humanistic quarantine has been a key to make this the command and control of an epidemiological group effective. And we have been hearing about the information technology that was deployed for the combat COVID-19. So thank you so much for sharing this with us. We will continue the discussion. And now I would like to introduce and to invite to share his experience to Nate Book, who is the CEO of the World Central Kitchen. Nate is a storyteller, an entrepreneur, and with experience in filmmaking and in technology and activism. And he joined the World Central Kitchen after creating the famous chefs for Puerto Rico. This was established after the Hurricane Maria, and they were critical in supporting the communities and the populations there, and they served nearly more than 4 million of meals to the people that were in need. So he is now the CEO of the World Central Kitchen, which was founded by the world-renowned activist and humanitarian chef José Andrés, who is from Spain and is absolutely our hero. So yeah, thank you so much, Nate, for joining us today and for sharing. We would like to ask you to share what is your experience in building resilience through the particular business model of the World Central Kitchen that has been supporting local restaurants and working, supporting entrepreneurs and not only the vulnerable population, but also all the food and local restaurants producers. So could you please share, how was your experience during the all the work that you have done during the COVID-19 lockdowns? That would be great. Thank you.
Great. Thank you, Christina, for having me and for all of the other amazing speakers here this morning or this evening, depending on where you are right now. So I want to step back a little bit and give a little bit of background about World Central Kitchen. You might not have heard of the organization or Chef José Andrés, but World Central Kitchen was founded in 2010 after the big earthquake hit Haiti, hit Port-au-Prince. Jose is a chef, a restaurateur. He was in the Caribbean at the time, ended up going to Haiti after the earthquake to see how he could bring his experience and expertise to support those that were impacted by this tragic earthquake that had really devastated the country. And while he was there, what he found was that there was this gap between many of the solutions that had been created and were being implemented on the ground as they relate to food, and that many of the efforts being undertaken were, being decided upon, being created by those that don't really know a whole lot about food. And he sort of felt, look, if we're talking about a medical disaster around the world, who do we send into medical disasters? Of course, we send in doctors, right? Doctors know the most about medicine and how to help people in emergencies. And yet when it comes to crises around food, we're not sending those that know food the best, which are chefs, which are people that work with food every single day. And so it began sort of this mission that Jose had to build a platform for chefs and those working in the food system to bring their experience and expertise on some of the big global challenges that the world was facing. And in the aftermath of the earthquake in Haiti, it wasn't just getting food to people, which of course was a very important thing to do, but Jose began to see where there were other flaws in the food system. One of those big focus areas was around clean cooking, for example. All around the world right now, we still have 3 billion people cooking with rocks and charcoal, and in a way that is creating a lot of smoke and other inhalants and impacting the health. But food is what's so powerful and important about food is that it touches so many other things. So clean cooking is not just an issue about the health of the women and the mothers that are preparing those meals and inhaling all of those dangerous gases. But it's about the children that have to go, the young girls that have to go and collect the firewood every day, and then they can't get an education. It's about the environment in a place like Haiti that has cut down all of its trees. You end up with erosion, and then that erosion destroys the soil, and then you can't grow anything. And then the soil goes into the water, which destroys the fisheries and other things. And you have all of this sort of interconnected systems all around food. And Jose felt that if you weren't thinking holistically about some of these challenges, then there really wasn't a good way to solve them, because everything would be a bit of a Band-Aid solution. And that was the beginning of World Central Kitchen, one plate at a time, one plate of food at a time, how chefs and folks like him could bring to bear their expertise. And as we grow the organization, we started to see the impact of climate on the world, as we all have in the past, especially in the past 10 years. In the United States, what used to be a once in a decade occurrence, a Category 5 hurricane, is now an annual occurrence, or sometimes multiple times a year. We're seeing this across the world with big typhoons and cyclones hitting places like Mozambique. It really shifted our work as a nonprofit organization from not only the long-term, what we call our resilience work and our long-term programs where we're focused on food security and clean cooking, but also on looking at the urgent response and how that can play a role in also setting a foundation for improving the long-term work that needs to be done. And so this really, as you mentioned, Christina, this work really started to grow after Hurricane Maria hit Puerto Rico in 2017. We saw the breakdown in the food system that occurs after a big disaster like that. The electricity goes out, the water goes out, the grocery stores are closed, access to food becomes a big problem. But I think what's most important about it is it's not just the disaster that's causing the food insecurity. It's the underlying issues that already exist, but the disaster really amplifies those issues. And so if you say we look at a place like Puerto Rico, Puerto Rico before Hurricane Maria was importing about 85% of its food. It's a beautiful Caribbean island. Puerto Rico used to grow 50% of its food directly right there on the island. So as it was so reliant on imports when Hurricane Maria hit, all of a sudden now that shot up to 95+% of food needing to be imported. And then you have a big hurricane that obviously has impacted the ports, the flights, getting food logistically around the country. And you start to have a breakdown in the system, and people don't have access to food because they're so reliant on the imports, and they're not food secure internally. So, I think as we started to look at the issues, and this is not isolated to Caribbean islands or even poor countries. We see this right in our own backyards in big cities in the United States, like New York. You have food deserts where big portions of the city don't have access to fresh food, don't have access to fresh produce, or can't afford, fresh fruits and produce fresh food to cook with. And so when a disaster strikes, that very little access to food gets even worse. So over the many years, we've responded as an organization to hurricanes, to wildfires, to volcanoes in Guatemala, to tsunamis and earthquakes in Indonesia. Last year to big cyclones in Mozambique, and working now as well in refugee crises in places like Colombia and Venezuela. as we try to mobilize and build local capacity for food relief efforts during crises like these. But the COVID pandemic was certainly something new for all of us. World Central Kitchen began our COVID work very early on, actually in February, when a cruise ship ended up stuck in Yokohama, Japan. And we were called in to be able to support the food that needed to be provided to the cruise ship, because they were preparing all of the meals on the ship, which clearly is a very bad idea when the virus had spread so widely on the ship. Even though we knew very little at that time about COVID, it wasn't even called COVID back then. And so, as we had to develop new systems, new protocols, how to prepare meals safely, how to get those meals to those that need them most. And so we were training in Japan during this time before the virus had even made it to the United States, and before the world really knew how bad this was going to be. The World Health Organization hadn't even declared it a pandemic at this point. It was still an isolated epidemic in China and some small parts of Asia where it had spread. But we knew that this was going to grow, and we started to look at how, as a fairly small organization, World Central Kitchen is not a massive organization with tens of thousands of staff members around the country, around the world. So how can we respond to a big crisis like this? And as COVID, as the coronavirus began to spread in the United States, first very heavily in New York City, we realized that we needed to come up with a new model. We needed a way to reach more people quickly, knowing that we were going to see a breakdown in the system. And unfortunately, what COVID has really shown us here in the United States is that we have a great fragility in our food supply chain. And that when one part of that supply chain starts to not work as expected, it starts to have a domino effect on the rest of the supply chain. We started to see this immediately across the country. You may have seen pictures of long lines at food banks as families went to go collect food because they were out of work, because businesses closed, they stopped receiving a paycheck, they couldn't afford to buy food for their families. So they went to food banks, they went to places to get food, and these long lines of people waiting for food. And yet, at the same time, we have images of farmers that are now plowing under their crops because they have nowhere to sell them, because all the restaurants are closed and the demand has gone way down. And we have dairy farmers that are dumping their milk. And so how do you have at the same time an excess of food and then a lack of food? And I think what it really emphasized, what it really showed us, is this fragility that we are not very good right now about getting food to where it really needs to be and filling those gaps. And it's an area that we have to work on. But it also, I think, was really a reminder that we are not very good at dealing with disasters that are everywhere. What we are good at least in the United States, and I think many other places, is focused issues, focused disasters. So a hurricane hits, there's a tsunami in one place, we start to mobilize both as countries and as global community, right? We start to bring aid in, we focus, everybody goes to one area and we flood this area with support and food and other essentials like tents or other things that are needed to get a society back up on their feet. But when that disaster is everywhere, from the big cities to the small towns, how do you tackle that? And that was a big challenge as we looked at as an organization that provides meals. Before the pandemic, we had served about 15 million meals worldwide over the past 2 years. Fresh, prepared, healthy meals. These are not packaged MREs or processed food that sits in a warehouse. These are mobilizing teams to produce high volume, fresh, healthy, nourishing food. But how do you do that everywhere? We can't be everywhere. So as we looked at the landscape in COVID, what we recognized very quickly was that what while World Central Kitchen might not be able to be everywhere itself, what is everywhere is our local restaurants, right? Local organizations, local small businesses that are already there in these communities that are ready to serve. And moreover, because COVID caused us to shut down all of the businesses and shut down restaurants, many of which are still shut down, these businesses had no way to survive. So we sort of said, well, why don't we look at this as a solution that can solve multiple problems? Why can't we activate these restaurants and pay them to produce meals for their local communities? And those restaurants can be everywhere. So World Central Kitchen has been active in over 400 cities in the United States. That would be unthinkable if we were to do that on our own without activating this huge network. We have 2,500 restaurants that we were able to get up and running. We were able to pay them to produce meals. And not only are they producing meals to families that are impacted and in need of food right now, but those restaurants are able to hire, keep paying their employees, which means that we don't have more people that are out of work and needing food. It enables those restaurants to buy from their local suppliers, their local farmers. So you start to get the system back up and running again. Because what COVID did was it locked the system. And when the system wasn't working, everything falls apart. And unfortunately, things like, government benefits or tax rebates or, loans to businesses, these are all Band-Aid solutions. These are all solutions that are simply short-term. But unless we get the system working again, the entire chain, we can't really solve the problem. And so that's what we saw. So we launched a program that we called Restaurants for the People. And this program, as I said, we were able to activate 2,500 restaurants across the country. We're able to have food go out to families in need, to first responders in hospitals that were responding to COVID, especially in the early days here in the United States when our hospitals were completely overwhelmed in many cities. We were able to really narrow in into small towns and small neighborhoods and then keep those restaurants alive, keep them buying from local farmers, while also making sure that we could get healthy and fresh food out to families. And the last thing I'll say is, I think as we recognize the challenges that we were facing with COVID, we also realized that we needed to empower and uplift those families with healthy and fresh access to food. The challenge that so often we face after disasters is that the default mode of providing meals is shelf-stable, processed food, and in the worst case scenario, MREs, which are called meals ready to eat, which are essentially what our military eats when they're on deployments, but became the standard to supply to communities after disasters because it's easy. And folks who don't know anything about food don't need to know about food. They just need to know about logistics and getting a package to somebody. But these things are barely edible. Children, seniors can't eat them. And so as we looked at this COVID crisis, we recognized that getting meals from restaurants, fresh prepared meals to families was only one piece of it. We also needed to make sure the families themselves could have access to fresh, healthy food they could cook with, because we weren't replacing all of their meals. So we were able to activate local farmers across the country. We've been providing what we call our free farmers market boxes or produce boxes that every week we're distributing in the thousands in cities like New York and Oakland and New Orleans and towns like Little Rock, Arkansas and Baltimore, Maryland, and providing this fresh produce to families, which I think is so critical right now, because the food banks were able to provide a lot of shelf-stable soups, cans, pastas, things like this that were, could last a long time. They don't require a lot of effort. They don't require refrigeration. But without the healthy component, then you're really missing something. So that's something that we've really been focusing on in the past month. We've now distributed close to 100,000 boxes of fresh produce and fresh healthy food. And we're doing this every week in addition to our prepared meals that we're getting out to restaurants, and really focusing on those communities that are most vulnerable right now while looking at how we can reach as many people as possible. So that's what we're doing. We've now served over 25 million fresh meals since March. So this is just for the COVID response, serving 25 million meals. We've had activations also up and running. Our relief teams in Spain, which has been hit hard. We were in 17 cities in Spain. We're also working on the US-Mexico border. We were working in Indonesia briefly last month when there was a big spike. And also we continue to work in Colombia and Venezuela during this crisis as well. So, trying to do our part, but I think what we're seeing is we can start to change the system, start to change the thinking and ask questions. Why can't we make sure that families have access to fresh, healthy food after in a time of crisis? Because it is possible. We just have to come together and do it. Thank you very much, Christina.
Thank you very much, Nate. No, this is great. I mean, only an entrepreneur mind can set up this, and I thought that it was a genius when I learned about this business model. So it's excellent. But also, I wanted to mention that this is something that the Red Cross, the American Red Cross, was saying in one of the meetings of that Sutsi organized last year. On disaster risk reduction, they were saying the first thing that in an aftermath of a disaster, the first thing that people are asking is when we are going to eat. So, you have been Sutsi and your group has been first responders, and the fact of bringing chefs, I mean, it's to bring another dimension to this response. The fact of caring about clean cook stoves totally is bringing an extra component and technology and opportunities for technology and for changing behavior. And one of the aspects that I have seen that is common to all the presenters have been about food storage. Dr. Mohamed, she was saying that they really have this handicap and this problem missing that. Dr. Min was saying that that was one of the best examples of success in the system. And you were talking about the fragility of places like Puerto Rico, in where they have to import 50% of the food. So that food storage and technology is something that we should keep in mind for the next talk. And in a way, the three organizations, you work with many volunteers. So this is also a critical component, and how you tell this story, the way of the storytelling to get these volunteers to keep going. They are young people, amazing people, dynamic, but the storytelling is very important, because otherwise you will not get them there. So, and this is great. And also you have been emphasizing the importance of promoting healthy diets through the production of fruits and vegetables and farmers markets. So thank you for that. And with all this in mind, I would like to invite our fourth panelist, Federico Villatico. Federico is an strategic advisor of the Climate Technology Center and Network. And he provides strategic advice on climate technologies and technology transfer. So he has a large experience on renewable energy and energy storage, and on also in the sustainable transport sector. But he also has experience in a lot of experience in international organizations, and he also knows very much about the storytelling. And this is something that can help to communicate with all the countries that they have been working in CTNC. CTNC, they have been promoting access to technologies that are supporting both climate mitigation and adaptation, and also a complete circular economy. So, and this is very important in these situations of disasters and lockdowns. So, Federico, thank you so much for joining us, and we would like to ask you to share some of the examples of the existing technological solutions that could be used by groups like the Kenyan Red Cross Society or Chuchi or World Central Kitchen for their their day-to-day work, but also in this case, to build up the resilience to COVID-19. So yeah, thank you so much, and the floor is yours.
I think I should be unmuted. Right. Thank you, Christina. Hi, everyone. Thanks for joining this very interesting webinar. Yes, I am very happy to present the perspective of the Climate Technology Center and Network, CTCN. We are the technology mechanism of the Climate Convention, of the conference, of the COP, of the Conference of the Parties, and we have the mandate to help developing countries to, in their response to their need to climate technologies by matching the demand with a great network of experts worldwide. We have now more than 500 network members, and then we mobilize them depending on the needs and the requests from developing countries. Now, I think there is a kind of leitmotif in all of the presentations that have been presented previously. In particular, I think the need for strong supply chains, that the COVID-19 pandemic has highlighted the weakness of global supply chains. Now, referring in particular to the presentations from the Red Cross and the World Central Kitchen, I think those that they have, they're very much food related. And on this, I think one could highlight what was also the topic of the so-called the TEM, the Technology Expert Meetings under the COP, and it was the Agri-Food Water Energy Nexus, which directly speaks to circular economy, if you want. In fact, for producing food, you need water and you need energy. You need not only the land and the products per se. So you have to build a system that can be also climate friendly, and there are several technologies that can help this process. For instance, in terms of energy, we need to look at systems that are more distributed. For instance, we can think of waste to energy, using organic waste through anaerobic digestion to produce biogas, and also foster, for instance, organize a set of biodigesters from the dairy industry. So we send this project along these lines. For instance, in Ecuador, we just finished quite a good project on biodigesters. And this also speaks about endogenous technologies that are resident in a local level or rural level. So rural communities, this may be, for instance, some of the examples in Kenya, where isolated communities can foster their own, produce their own local energy through, for instance, these technologies. That could be also composting, meaning from organic waste to produce fertilizers and then feed the local agriculture. You were also mentioning yourself efficient cook stoves. We have worked, for instance, in Guinea and in Ethiopia on electric cook stoves and also on metal ceramic. Those topics, we are trying now to lift this to more NGOs type of level, as we are trying to increase also the technology level, the innovation of developing countries. But obviously, this is a very high topic, because in some of the countries, between 60 and 80%, especially in Africa, I would say some of the LDCs, the least developing countries, between 60 and 80% of their energy production is actually coming from cooking. So you understand how this can also impact the climate level and also at health level, because as it was said, they are, if they are quite old technologies, they produce a lot of pollutants emissions at household levels. Now, another important aspect of this is the gender mainstreaming. CTCN is really much at the forefront of it. We have, for instance, implemented technical assistance in West Africa, in the ECOWAS space, where we have analyzed in 15 countries the impact of gender mainstreaming as far as energy is concerned, because the large majority of these cooktop-based cooking systems at household level, they are run by women, and there are women also that are looking for food. So gender and energy are very much interrelated in those regions. And clearly, I think circular economy will be a very strong response to this. So develop locally, stronger local supply chains will definitely help respond in a more efficient way such situations like the pandemic. Now, moving towards instead the presentation by the Tsuchi Foundation, and in particular the nice concept of the climate smart hospitals. I think there are again technologies related to energy, obviously, like renewable energy, for instance, batteries, storage, for instance, to reduce diesel genset and then local pollution, and also noise, because diesel gensets are quite noisy. One, stepping up even at the higher level, you can also think of hydrogen energy and fuel cells that are these electrochemical devices that are able to produce water and electricity, water vapor and electricity as a byproduct, just using hydrogen as a fuel, if you want. And they also have the capability of producing oxygen, which obviously is a very much noble gas that is being used in hospitals. And imagine also during this pandemic, COVID pandemic, this was one of the main feedstock needed by hospitals in particular for the intensive care sessions. Now there are also other technologies like low enthalpy geothermal, meaning exploiting the heart and the heat that is stored within inside the heart to produce heating and cooling, and without emissions for buildings. And another interesting topic would be the medical waste management. Some of the countries, they came out to us with questions on this. We have not yet provided specific technical assistance on this topic, though we have analyzed a bit technologies available, and in particular, from quarantine facilities and also high-risk clusters. Best technology will be incineration and at local level, in order to handle and to avoid even the spread of the supply chain for reaching, for instance, specialized landfills or waste treatment plants. There are several options apart from incineration, for instance, the autoclave, sterilization, but options are there. And in case you have questions, feel free to reach out to CTCN for specific answers. And lastly, I would like just to share that CTCN is preparing a white paper for specifically trying to define a strategy for developing countries, in particular for LDCs and SIDS. Also, the small island development states, they have been really affected by this pandemic, and also has been very well presented the fact that they have, since they have limited land to take advantage of, they need to make stronger. They make to have a supply chain definitely more efficient, especially as far as food is concerned. Now, our white paper is focusing on giving advice to countries to develop a more efficient response to COVID-19, and in particular, we are targeting measures and policies that could be, along with financial schemes that countries could take advantage of to achieve a green recovery. And what we are also pushing is, again, circular economy as a medium to raise the ambitions of their NDCs. The NDCs are the nationally determined contributions, meaning their climate commissions to the climate convention. And so there will be a next delivery for the COP26 that has been delayed because of the COVID-19 to next year. So all the countries, the developing countries, also developed countries, are updating their climate commitments. And I think what CTCN is very much encouraging all countries is to embed circular economy principles into those climate commitments, because we believe that the climate agenda and the circular agenda are connected. And actually they should be one single agenda, ideally, because circularity means taking care of all of the materials that are being inputted into the economy. So, and especially at emissions level, what sometimes is disregarded is the fact that at the production level, if you look at the global emissions, the 70% of the global emissions are concentrated at the production level, so at the material extraction level. While we tend to concentrate more on the use side, meaning the 30%. So the benefit of the circular economy is that instead is bringing back the focus on the extractions, on material avoidance, in terms of inlet into the economy. So this is our strong message. And to conclude, I would say that there is also need for capacity building alongside technical assistance to increase the capacity and the knowledge of local people. And more or less all of the technical assistance of CTCN, they have embedded a small capacity building module, meaning either training or some webinar, especially now these days, webinars are so much more accessible. And yes, I mean, that will be my conclusion on my intervention, and happy to take any questions you may have. And back to you, Christina. Thank you.
Yeah, thank you so much, Federico, for sharing all the possibilities that you have been, and you have more. All the possibilities that can be used from the work that the network is doing and could be used by civil society and other groups. So you have been talking about the life motive of getting these stronger food supply chains, and the importance of the nexus of water, energy, and food, and the circular economy and the circularity, which is totally has been in line with the green recovery needs after COVID-19. We have been seeing huge amounts of food waste in Europe and in other places, and all the technologies that you were mentioning were critical. Like the nexus food and energy is critical for all the circular economy achievement. So one of the issues that you have been highlighting was the links, the important links in between gender and energy, all the work done with clean cook stoves, and all the work and the opportunities for medical waste recovery as well, which is some of the central work that has been done in 2G. So thank you so much for all this, and now it will be great if you could share your questions and comments in the chat or in the link in Google. We have received some of them already, and it will be great if you could indicate to whom is directed your question, so they can more easily reply to them. But for example, we have received some questions from the YouTube chat that have been incorporated in the Zoom chat. Let me see. It was. We go here. Yes, it was a comment for Nate from the YouTube stream, and that they were asking if World Central Kitchen could disseminate what they were doing in other cities in the world, in Manila, for example. And then those in Manila can disseminate the practice in other areas in Philippines. Yeah, this is, thank you for the comment, Bernardo. So that's a question for Nate. We also, let me see. Okay, they were also for Nate. There was a question on about the most plant-based meals in World Central.
I can answer that. Yeah, we very much focus on culturally appropriate meals. I think what really the magic of folks who really know food and chefs and working with local chefs, especially wherever we are, the idea is that we're able to create meals that are culturally appropriate and also, things that people want to eat. So we definitely focus very heavily on making sure we include a lot of plant-based meals, and we always have vegan and vegetarian options everywhere that we're operating. But in some places, we definitely do incorporate protein, animal proteins, meats into the meals as well. Especially for places where that is, a staple or a necessity into the diet. But it depends. For example, with our COVID response in Indonesia, we were doing a lot of fish dishes because that was where we were serving in Indonesia. That was part of the diet, and so it's definitely about making those adjustments, but we always really heavily focus on a lot of fresh vegetables. We always try to, even though it can be very expensive, we try to distribute fruit as well. We do not prioritize the cheapest and the most effective way to get people calories. We think food is much more than just sustenance to survive. We think that food is something that is also a message of hope, of that somebody cares about you and is going to help you get through the day and into tomorrow. And so we put a lot of love and care into, our chefs put a lot of love and care into the food that gets prepared. But it's also important we use very fresh ingredients. We try to buy locally as much as possible. We incorporate fruit everywhere we go, especially in the United States, making sure that we have fruit that's available for kids and families. And what we see is amazing because, you would think that, a child would want a bag of chips or a candy bar. But actually what we see is kids want fresh apples and fresh oranges, because a lot of the places that we're serving these families don't have access to those types of fresh foods on a daily basis because they might live in a food desert. They don't have enough money to buy fresh food, which unfortunately is, especially in the United States, is way too expensive than it should be. So that definitely is a focus. And to the other question, which is a great one, is it is very important that we build local capacity and resilience, and we train everyone that we work with, and we work on the ground with local teams and local chefs. So we have worked in the Philippines after some recent typhoons. We work with chef associations. We are working on building a culinary curriculum in Indonesia. Where we worked in Mozambique, it was about training and working with local staff and hiring locally, and because they were going to know, what the meals that we're preparing in Indonesia are very different from the meals that we may be preparing in Florida, for example. And so it's so critical to have that local knowledge and context and be able to prepare them. But it's a great question because, again, I think having plant-based meals and making sure they're available and educating families on the nutritional aspect is important. We are a disaster relief organization. I mean, we do a lot of long-term food resilience and food security work, as you mentioned, Christina. But we also have a director of nutrition on staff. We have somebody that's really focused on looking at all of our meals and how can we improve them? What are some things we can do? I'll give you one last quick example. In Colombia and Venezuela, we started to incorporate beets into our meals. This isn't necessarily a normal something that was always part of the standard diet, but we saw there was deficiencies, and beets are great, great ingredients, great vegetables to put into a dish to cook with. And so we're able to incorporate them into existing dishes to add a lot of nutrients and healthy components. So we're always thinking about that. And I think, again, it's about dignity. It's about respecting those communities you're working in. It's not just throwing food at people, but it's about how can we make sure we give them the best of what they need right now.
Yeah.
Christina. Okay, sorry. Yes, I was saying that I received a question about the technology, so I'm happy to respond to that whenever convenient.
Yeah, thank you so much. Yes, I think that Nate has responded the other questions about training as well. So yeah, please, Federico, go ahead.
Yes, I mean, I was mentioning about the incineration, obviously. I mean, for time concerns, so obviously this has to be a kind of specialized incineration. There are several, like twin chamber incineration, brick built with barrel incineration with air induction, and that there should be also on-site pit burial. So these are kind of specialized type of incineration because of the hazard of this special medical waste. I myself, I'm not an expert in particular on this type of things, but technologies are there. So happy to share more details on a bilateral basis. This is to reply to Claire. And there was also another question to me. I think I'm not sure if this was kind of maybe a funny question anyway. So I don't think we're gonna get any certificate here. It's just a webinar to share information. Thank you.
Yeah, thank you so much, Federico. So there are other questions. I mean, this is not directed to anyone in particular. So choose who wants to take it. That will be the measures in both the health and agriculture sectors to be taken by low and medium income countries to mitigate the adverse impact of climate change in areas that where they have large population numbers that have been affected by COVID-19. I mean, this is quite a comprehensive question, but if somebody wants to take it, that will be great. Yeah, which is linked to another question on the key lessons learned in sustaining food systems in the COVID times.
Well, I can take generically the fact that, during this COVID time, we have seen on one side a decline of the emissions, especially because in the developed world, there was a very much reduction in the energy consumption. However, the developed world as a different type of energy mix. No, the society is the emissions are mainly concentrated on the industrial side and the energy side, while small island development states and developing countries, they have less industrial footprint in terms of climate change. So this also gave an idea of the imbalance between the two sides. So I think now we're more focusing on the developing countries side within this webinar. So I believe that what has been highlighted in terms of climate is that now the risk is that since there is a lot of need for recovery, the climate aspect will be disregarded. Instead, this is a very much an opportunity to inbuild now a climate prone approaches and policies in the green recovery. So I think it is a very big opportunity. And that's why I think, again, to come back to the concept of the circular economy, I think that is the answer. Not only for developing countries, because even the US, Europe, we have experience, the developed world experience. This COVID gave us the kind of an assessment of how much weak our economy could be, especially in terms of supply chain. And the example of that Nate was sharing. I mean, Nate is focusing on the US, no? So I think imagine what happened at food level in developing countries, no? So I think that would be a very strong response, not only at the economical level in general, but even to strengthen the climate response. That would be my take.
Thank you so much. Thank you so much for the response. So there is a question I can see for Dr. Ming. Let me see. That was from YouTube. If you have enough facilities for COVID testing and healthcare in case of surge or increase, and if you have a healthcare policies on COVID.
Yeah, and then in Taiwan, we build up our testing capacities because now originally we can test like a couple hundred a day, but now more than like 5,000 a day. But because the case number is still low, so we didn't use it up, and we now prefer to use quarantine, because if you quarantine and then completely, and then it will prevent the further spread of the virus, because we don't have community cases for more than 100 days, so it is better. And then the policy for the healthcare is now we deploy ahead. We build up the isolation room now from like 1,000 isolation room in hospital, now more than 3,000 room. But because the control is quite good, so we don't have many cases now. In case we have this kind of community spread, so the government, they accredited every hospital to build up more isolation room now, preparing for. There is a policy for preparing the further community spread. We are now still, we hope we don't need to use it, but we have this kind of preparation.
Okay, thank you very much. So we have to wrap up, but there is a question that I have seen in 2 channels that is going to Dr. Asa Mohammed, which has been looking in the, they have been asking about arid and semi-arid lands, and what could be solutions for creating community-led solutions, and a culture of change need to transform the way that they interact with our food systems, but also how locals could reach that goals and help to support organizations like yours, like the Kenyan Red Cross. Yes, thank you.
Thank you very much, Christina. I think maybe one of the things I'd like to say is that especially for arid and semi-arid areas, what is critical is really trying to look at innovative ways and introducing also different aspects in terms of food production, because we know that some of the traditional systems may not continue to be viable because of different issues, including, yes, when we talk about climate change. And that is one of the areas we also work in very closely with communities in trying to address and bring to realization the fact that there needs to be a change. And this is where, of course, it becomes difficult in trying to get communities to think of alternative means, even including alternative crops. For example, a lot of communities in Kenya, are used to growing maize, even in some of these areas where then we are saying it's time maybe to diversify and grow other kinds of food crops that are more resistant to some of the conditions that come about. So I think there's that aspect of trying to educate and sensitize communities in terms of the alternatives that can actually even give higher yields and can also even be more nutritious than what they are also traditionally exposed to. And one of the ways of doing that is actually doing some pilots in some of the communities and demonstration farms or projects to be able to show that it's possible, because without that, then sometimes it's difficult for communities to accept that, yes, they can change. There's also the question about the pastoralists in terms of how they can also maybe not only continue to remain as pastoralists, but also do a bit of agriculture at the same time. So I think these are some of the issues that we are looking at. But of course, it's a culture change, and therefore it's a bit difficult in terms of how to proceed. But I think also more importantly, Christina, for me, I think it's also about some of the perception or cultural ways of demarcating certain areas in the country for certain production. For example, if you go to the coast region, then a lot of the people in the coast will say, well, we can't grow vegetables in the coast because this can only grow in the other parts of the country, maybe coming from the central part of Kenya, and therefore then missing an opportunity that, yes, there are many other ways that they can actually be food secure without having to depend on food coming from other parts of the country. And therefore, in a situation like today, then they would probably have had more food within their own localities and not have to depend on food coming from other parts.
Mm-hmm. So thank you so much, Asa, and thank you so much to all the panelists for responding the questions. We have a link where other questions could be responded if they have not been addressed now. We have to conclude now, and I want to thank you so much for sharing these lessons that are emerging from the actual response and that can help communities to come back to value the essentials, to increase social cohesion, to reduce unsustainable consumption and waste, to increase circularity, and to invest in public health and in resilient food systems and sustainability. So the crisis of COVID-19 has shown that the transformation into more sustainable food systems, health systems, and lifestyles is possible. And for this reason, we would like to keep inviting you to join us to this series of webinars, the Solutions Space, to explore in more in-depth these topics. And we have more planned webinars coming up through the summer, looking into One Health, sustainable health diets, and the green recovery and inclusive recovery. So stay tuned with that. And I would like, on behalf of all the co-organizers, to thank all the participants, the panelists, and the co-organizers, and particularly Jimmy Yang, who has been really supporting